and a very good morning to all. My name is Nurul Izzati and I am from Group 6. And today we will present on the National Immunization Program NIP by Ministry of Health. Our group members consist of 3 persons. First, my name is Nurul Izzati binti Miswan. Then we have Putri Nurdiana Amira binti Rostan. And lastly, Hanis Farah Liana binti Zainuddin. The National Immunization Program (NIP) in Malaysia introduced to provide free vaccines to protect children against 13 major childhood diseases. The 13 diseases preventable under the NIP are diphtheria, Haemophilus influenza type B, hepatitis B, human papillomavirus, Japanese encephalitis, measles, mumps, pertussis, whooping cough, poliomyelitis, rubella, tetanus, tuberculosis, and pneumococcal. The vaccinations are provided free of charge at all government clinics across the country, and they are also available at the private clinic. However, you may have to pay a small fee for them. Okay, next, I will continue on the National Immunization Schedule online based on the chart. It shows the routine vaccination from birth to adolescence to protect against major infectious diseases. At birth, BCG and hepatitis B vaccines are given. During early infancy, combination vaccines and pneumococcal vaccines are administered in multiple doses to provide broad protection. Measles and MMR vaccines are given between 9 and 15 months, with Japanese encephalitis vaccination included in specific regions. Booster doses are provided during school age and adolescence, and the HPV vaccine is administered to adolescents to prevent the HPV-related diseases. And overall, the schedule ensures early, sustained, and long-term immunity. That's all from me. Thank you.
Thanks to my team members, next I will continue with the policy problem. So, Malaysia National Immunization Program, which is NIP, has been effective in providing widespread childhood vaccination and reducing vaccine preventable disease. So, several policy problems remain. Change in population needs, difference in access, and public attitude towards vaccination have created new challenges for the program. Issues such as vaccine hesitancy, limited coverage beyond childhood, age gaps in policy implementation can reduce the overall effectiveness of the NIP. Therefore, it is important to identify and address this policy problem to ensure continued public health protection and long-term sustainability of the immunization program. There is 4 problems in Malaysia National Immunization Program, which is firstly limited scope of vaccine. Malaysia National Immunization Program (NIP) mainly focus on childhood immunization, while adult vaccines such as influenza are not included in the free program. This limits protection for adult and senior citizens, especially those with chronic illness who are more vulnerable to preventable disease. Most adult vaccines are fee-based and primarily available through private healthcare, making access dependent on an individual abilities to pay. So, this creates inequitable access, particularly for low and middle income group, and reduce overall population immunity. The second problem is low adult vaccination uptake. So, adult vaccination coverage in Malaysia remains very low, particularly among older adults. For example, based on Malaysian health and immunization data, only around 5% of senior citizens receive the influenza vaccine, despite being at higher risk of severe illness and complication. One of the main reasons for this low uptake is that adult vaccines are not provided for free under the NIP, requiring individuals to pay out of pocket, which discourages participants. The low vaccination coverage reduced the overall public health impact of the immunization program. It increased the risk of disease outbreak, lead to higher rates of hospitalization among older adults, and place additional strain on the healthcare system. Evidence suggests that introducing free or targeted vaccination program for high-risk groups such as older adults can significantly improve uptake, reduce healthcare costs, and prevent avoidable illness and death. So the third one is vaccine hesitancy and misinformation. Vaccine hesitancy remains a significant barrier to the success of Malaysian immunization program. It is mainly driven by misinformation and myths, concern about vaccine safety, religious issues such as halal status, and a general lack of trust in vaccine and health authorities. The widespread use of social media has allowed false and misleading information to spread quickly, increasing fear and confusion among the public. So, as a result, some individuals delay or refuse vaccination, reducing overall coverage. Healthcare providers also face challenges in addressing hesitancy due to limited time, training, and standardized communication resources, which weakens effort to counter misinformation and promote vaccine acceptance. So the fourth one, which is the last, is unequal access to vaccination service. Although Malaysia National Immunization Program (NIP) has improved overall vaccine coverage, unequal access to vaccination service remain a major issue, especially in rural and remote areas. People living far from health clinic often face long travel distance, limited transportation options, and fewer healthcare facilities. Some clinics also have limited operating hours, and there may be a shortage of healthcare staff. This barrier can cause delay or missed vaccination or appointment, leading to lower immunization rate in these communities. As a result, more people remain unprotected against preventable disease, increasing the risk of outbreak and reducing the overall effectiveness of the NIP.
There are 5 objectives in the National Immunization Program policies. First is to prevent diseases. The NIP is used to shield the population from major infectious illness like measles, polio, tetanus, hepatitis B, and HPV. Second is to build herd immunity. Vaccinate 75% to 95% of the community to stop the disease transmission and safeguard those unable to receive vaccines. Number 3 is to eliminate or eradicate diseases. This vaccine is used to pursue the complete removal of diseases such as polio, following the example of smallpox eradication. 4 is to promote health equity. This is to provide equal access to immunization for all children and at risk group no matter their background. And lastly, economy efficiency. This NIP program is used to cut healthcare costs and reduce strain on the system by preventing outbreak before they are occurring.
Thank you, Izati. So my name is Putri Nurjana Amira binti Rustam, and today we will explore the strategies behind Malaysia's National Immunization Program, or we call it as NIP. So the NIP implies a multifaceted approach combining service delivery, policy planning, and also digital innovations. So its primary goal is to strengthen our national health security by ensuring vaccines are accessible, efficient, and trusted by the public. A key part of the NIP is that vaccination are provided free of charge to all Malaysians. This is because the government fully pays for the vaccine, so the families do not have to worry about the cost. And as a result, low-income and rural families are more willing and able to bring their children for immunizations. So this approach will help remove financially barriers and therefore allows more children to receive timely vaccinations. So in this way, the program ensures that the child health is protected regardless of the parents' financial situations. Secondly, our backbone is the extensive primary healthcare network, which includes major hospitals and clinic kesihatan. Not only that, we also go further by sending mobile health teams and boat clinics to interior areas of Sabah and Sarawak. So through this effort, we were able to reach orang asli settlements and island communities. And as a result, people living in remote areas can still receive vaccines, and therefore, geography doesn't become a barrier to the immunity. Next, for all the children that NIP use school as a central vaccination point, this is because it makes it easier to give HPV and booster shots to many students at the same time. As a result, the process becomes more efficient and reduces logistical problems for working parents. At the same time, it ensures that adolescents who may not often visit clinics still receive a regular and consistent protection. The NIP also understand that trust is just as important as the vaccine itself. Therefore, the ministry carries out a wide awareness campaigns through television, radio, and social media, and at the same time, it works closely with NGOs and religious organizations. As a result, this effort helps counter online misinformation and at the same time reassure parents about the safety of the vaccine. Another strategy is the NIP has improved through digitalization, especially with the use of My Sejahtera apps. This system not only will help you to track the vaccination records and provide educational information, but at the same time, it reduces administrative error for healthcare providers. As a result, for families who move between states, their vaccination record can be accessed easily in the apps and continue without disruption. So behind the scene, we also maintain a strong disease surveillance through systems such as e-notifikasi. So this system allows us to detect outbreak early and at the same time identify areas with low vaccination updates. As a result, we can also assess the effectiveness of new vaccine using a real-world data and respond quickly when needed. So for your information, Malaysia does not work alone. Instead, we work closely with organizations such as World Health Organization, UNICEF, and Gavi to gain access to global best practice and research. So through this international cooperation, Malaysia is better prepared to manage emerging health threats and handle challenges related to the global vaccine supply chain. Finally, although the vaccination is not legally compulsory, the government used indirect policy measures to encourage compliance. For example, immunization records are required during the school registration, and therefore parents are more likely to ensure their children are fully vaccinated. In this way, hard vaccination coverage is achieved without the need for legal punishment or strict enforcement.
Next, I will continue with the policy evaluation. Malaysian National Immunisation Program (NIP) has played a vital role in protecting public health by achieving high vaccination coverage and reducing vaccine-preventable disease. The program's success is supported by strong government coordination, free universal access, and a well-established healthcare network. However, the NIP also faced challenges such as vaccine hesitancy, limited access in rural areas, anti-vaccination group, and poor appointment compliance. Thus, a balanced evaluation of its strengths and weaknesses is necessary to ensure continued effectiveness and improvement. Firstly, I will discuss about policy strengths in policy evaluation. The first is high childhood vaccination coverage. One of the major strengths of Malaysian National Immunisation Program (NIP) is its high childhood vaccination coverage. The program has consistently achieved coverage above 90% for most vaccines, which has contributed to a significant reduction in vaccine-preventable disease such as measles, polio, and diphtheria. This high coverage demonstrates effective program implementation and strong public compliance with the immunization schedule, resulting in improved child health outcomes. The second strength is free and universal access to vaccine. The NIP provides free vaccination service for all children through government health clinics. By offering vaccine at no cost, the program ensures that financial barriers do not prevent children from receiving essential immunization. This approach promotes equity and reduces health disparities, particularly among low-income families, allowing all children to access life-saving vaccine regardless of their socio-economic status. The third one is a strong government coordination and standardization. The Ministry of Health (MOH) centrally coordinates the NIP at the national level, ensuring a standardized immunization schedule, procurement, distribution, and monitoring across all the states. This strong government coordination improve efficiency and ensure consistent quality of service nationwide. The structure, monitoring and evaluation system also enable effective tracking of immunization coverage and vaccine safety. The last tranche is well-established primary healthcare network. Malaysia's strong primary healthcare system supports the effective delivery of immunization service. With a wide network of clinics in both urban and rural areas, the NIP can reach children across the country, including those in remote locations. This infrastructure enables efficient vaccine delivery, follow-up and outreach service, contributing significantly to the success of the national immunization program. Next, I will continue with the weakness in policy. The first weakness is vaccine hesitancy due to misinformation. One major weakness of Malaysian NIP is vaccine hesitancy, which is influenced by the spread of misinformation on social media. False information about vaccine safety, side effects, and religious concern creates fear and distrust among the public. As a result, some people become reluctant to vaccinate, making it difficult for health authorities to maintain high immunization rate. The second weakness is limited access in rural and remote areas. Another challenge is limited access to immunization service in rural and remote areas. People living in this location often face transportation difficulties and long travel distance to reach clinic. And in addition, there are fewer healthcare facilities available, which reduce the opportunity for children and families to receive timely vaccine. This contributes to lower vaccination coverage in rural communities. Third one is presence of anti-vaccine communities. The presence of anti-vaccine communities also weakens the NIP. These organized groups actively oppose vaccination and spread negative messages to influence public opinions. Their activities can increase vaccine refusal and delay vaccination decision, which undermine effort to achieve herd immunity and protect the wider population. So the last weakness is poor follow-up and appointment compliance. Finally, follow-up and appointment compliance is a weakness of the program. Many families misschedule vaccination appointment due to busy lifestyle of late or lack of reminder. Without a comprehensive tracking and reminder system, some children may not complete the full immunization schedule, reducing the overall effectiveness of the NIP.
So thank you, Anis. That summarizes our current framework. However, to ensure a long-term sustainability and effectiveness, we have identified several key areas for improvement. So let's take a look at our recommendations. First, we need to improve our digital platform because users are currently facing problems such as login failures and incomplete records. Therefore, a centralized system that connects in a real-time data with clinics and hospital database should be developed. As a result, data duplications can be avoided and records will be more accurate. In addition, a better offline support must be included so that users in rural areas can continue to access the system without any disruptions. Next, we need to extend outreach to the underserved group, including migrants and indigenous communities. Therefore, a transport assistance should be expanded and clinic hours should be made more flexible, such as offering after-work sessions. At the same time, the cold chain infrastructure must be strengthened so that vaccines remain safe and effective during the transport to the remote areas. So to address the rise of anti-vaccine narrative, a proactive strategy is needed. Therefore, the Ministry of Health should work with trusted influencers and religious leaders to share content that is relatable and trustworthy. At the same time, platforms like TikTok and Instagram should be used to post short video, educational video, and live Q&A session can be conducted to debunk rumors quickly and also in real time. Transparency, yes, transparency is essential for rebuilding trust because parents often worry about what they do not understand. Therefore, a clear, no jargon word, not complicated, and a simple information about side effects should be published, along with monthly reports on vaccination coverage. So, by providing parents with accurate data, their fear caused by uncertainty can be reduced and confidence in the vaccination program can be strengthened. So to align with global standards, we recommend to increase the funding to introduce a new vaccine such as rotavirus and influenza. Although the initial cost may be high at first, but the long-term saving from reduced hospital admissions and complications will make this a financially wise decision. So finally, we need to address the vaccination coverage gaps caused by the COVID-19. So a catch-up campaign should be reintroduced in schools and digital consent forms should be implemented to make the process become faster and more efficient. At the same time, a stronger collaboration between the Ministry of Health and Ministry of Education is essential to ensure that children are protected during their most vulnerable years. So that is all for me. I'll now pass to Izati. Thank you.
As a conclusion, the Malaysia's National Immunization Program is essential in protecting public health by preventing vaccine preventable diseases and achieving high immunity coverage. Despite challenges such as vaccine hesitancy and access issues, strong government commitment, effective policies, and public education ensure the program continue to safeguard population health. That's all from our group. Thank you.